Okay, so I think let's start. You can start.
Thank you. Should I wait for everyone to be muted? Okay.
I'm muting everyone.
Okay.
I'm sorry.
No worries at all. I understand. I often don't mute myself when I enter spaces. So, well, good evening, namaste, namaskar, and welcome to everyone. So good evening to those of you in India and good morning to all of you in the US. Welcome to our three-part workshop series on grief. So I am so excited that we are starting this off, and this is our kickoff event. I just wanted to share with you a little bit. You know how in England they all talk about the weather when there's nothing else to talk about. So I'll just start with the weather here. So today is a cool day in Boston, almost like a bit of a relief from the summer heat, and I'm in Boston right now. And this cool weather is just, you know, in our part of the United States means that the cold weather is coming. So we might get a few more days of heat, but we know that change is inevitable. And with every change comes loss. No matter how wonderful that change is, there's invariably a certain degree of loss. The loss of hot summer days means that winter is coming. Well, with, you know, climate change, things are more unpredictable, of course. But, you know, we go through these changes every single day. And so much of what we experience is based on our own experiences in our daily lives, but also our experiences since childhood of these changes and how we process them and how we understand them. We also have our historical stories that are told to us based on who we are as individuals and as part of a community. So all of that influences how we process changes, particularly those associated with loss. And so having said that, I will just kick off this, what I'm looking forward to is a wonderful presentation. So this presentation that you're going to be hearing today is titled Managing Grief During COVID-19. So this session will provide a general overview on grief. It will focus on different clinical strategies from a systemic lens used for grief, bereavement during the COVID-19 pandemic, and particularly focused on New York City. This presentation is by Ms. Urmi Chakrabarti, who has over 12 years of experience as a behavioral health wellness professional. She has been in different capacities as a therapist, activist, educator, workforce developer, and even public health professional. So she brings her lived experience of being multicultural and focusing on multidisciplinary training in our field to create the safe space of unconditional positive regard for her clients, where they can unpack their layers of truth and purpose. So her approach is very strength-based. She looks at the individual within their current context. She draws from diverse modalities, such as object relations, emotion-focused therapy, attachment theory, liberation psychology, positive psychology, CBT, as you're maybe familiar with, cognitive behavioral therapy, dialectical behavioral therapy, and she uses mindfulness strategies that are rooted in Eastern philosophies. And, you know, she has a very rich life outside of her professional life. She is inspired by theater and the arts. And just on a very, very personal note, she is a dear friend. I have known her forever at this point, and I'm very, very, very proud to call her my colleague. And the fact that she is here is it's just such an honor for me. So I'll just quickly give you a brief overview of the next couple of sessions, just so you know. We have the next session by Dr. Nancy Sweeney on grief and the service provider. That's on August 31st. That's Tuesday at, again, 7:30 your time. That will examine the impact of trauma and loss by focusing on the experiences of service providers during the COVID-19 pandemic. And then we have the next session, the last session will be on September 4th. again, at the same time, focused on realistic self-care in times of crisis by Ms. Summer Collins. And that session will focus on practical tools for managing and processing grief, even during challenging times. So that will be a very interactive session. And both of these sessions have so much promise, and I'm so excited that we can bring this content to you. On my part, what I will do is I will monitor the chat box. Ms. Chakrabarti here will be presenting for about an hour or so. So I will monitor the chat box and collect all your questions. Please post them on the Facebook feed as well as in the Zoom chat box, whichever you have access to. And I will make sure I collect them. And after Ms. Chakrabarti's presentation, I will share those questions and ask her one by one. So hopefully we'll have time for everything. And with that, I'm going to hand over the reins to Ms. Chakrabarti. All right, it's your field now.
Thank you. So I'm going to share my screen. Let's see. Oh. Okay. Hold on just 1 second. Oops, that's not it. Okay. Sorry about this. I'm just trying to. But good evening, everybody. And thank you for that wonderful introduction, Uma. Yeah, so I had it here just a while ago. But...
Take your time. Don't worry. Technology is not my strongest suit.
Oh my gosh. If you need
help, let me know.
Okay, sure. Thanks, Uma. There we go. Oops, it's not. Okay, so I think can everyone see my screen?
Yes, we can, thank you.
Oh, okay, so I'm just gonna open this up. Okay, so yes, welcome everybody. Thank you so much for that wonderful introduction, Uma. I know Uma and I go way back, and it's such an honor to be here and to be a part of this collaboration, and being able to learn from you guys too, as we are kind of coming together as mental health frontline workers, health workers. So basically, my family is from Kolkata, India. They immigrated to the US in the 70s, and then I was born and raised in the States. And a little bit about my journey, I guess. Grew up in Texas, and with you guys, I guess I experienced the grief when COVID hit New York City as a frontline worker and social worker, and also through extended family while you guys were also experiencing grief in India. So today I'm just going to wanted to really make sure this session is as interactive as possible. I know it's hard with a lot of people joining. So I was going to do a general overview of grief, the impacts mainly of COVID-19 on grief and the grieving process, different treatment approaches that I found helpful and find helpful when working with grief, and ecological impacts coming from an ecological lens to really help us organize the different stressors that we're facing as clinicians while dealing with grief in times of COVID. And throughout the presentation, I will be asking some open-ended questions. So I don't know how we will manage that, Uma, but we can try to check in on time to see how that goes. So it's, you know, or we can leave it till the end. Basically, just a little bit about where, you know, where New York City is and where I am. I just wanted to give you an idea of where I'm coming from. So just like many places in Europe or many places, the United States also was claimed and colonized by different European groups. People actually started to settle in New York around 1609 after Henry Hudson sort of came and claimed the space through the Dutch East India Company. And the land is actually indigenous to Native American groups, the Lenape, Algonquin, and Wequaschek people. And New York City, as many of you know, is one of the cultural, media, financial capitals of the world. It's one of the most populous city in US. And as most urban centers, it has a huge disparity in income wealth gap. It houses the largest numbers of billionaires in the US, and it has, you see, extreme poverty and homelessness as well. Being the cultural hub, media hub, financial hub, you see there's a rich history of just social movements, dialogue, and then also a lot of conflict with different immigration movements and people coming in and claiming places. And so the city has seen a lot just growing and developing to where it is and how it is now. But now transitioning to how it was at the beginning of COVID. So what made the New York experience unique, and also a lot, you know, the experience in Italy unique, was we were one of the first epicenters of COVID. And so as a result, there was just lack of information and misinformation. So a lot of just sense of scarcity, not knowing what was happening, what was coming our way. It almost felt like I was talking to a lot of my colleagues, and even with Nancy and Summer yesterday, it felt like we were getting these messaging that the zombies are coming, and we're all waiting and didn't know when they will knock at our door, that kind of sentiment. So with that, everything happened very quickly. I remember first week of March, we were still kind of talking about how, oh, it's just like the flu, no big deal. By second week of March, we were scrambling, the grocery stores out of stock. Never seen anything like it in my life growing up here in the States, where everything was just empty. Shelves were empty, people not having enough hand sanitizers, masks, everything was just sold out. And then frontline workers also just panicking, people trying to reach their families, also being told not to go to their families. So just a lot of compounding effects initially, and just not knowing what was going on. And we had not the best leadership during that time too, on top of that. So there was just this sense of just being scattered and in crisis. A lot of the hotspots, so New York is broken into 5 boroughs, which you can probably see on the screen. So there's Manhattan, that's where most of the tourists, you know, that's what you see mostly on TV, the Empire State Building, Central Park. And it's also very segregated by income and wealth and race and ethnicity. And then there's the Bronx, which is mainly different sectors of the working class community. And you do see a lot of poverty there too. And there's also a lot of old established white working class communities. And then there's Queens, which is one of the world's most diverse, probably the diverse place. You go to Queens, all different class backgrounds, all different languages, people, you just see the diversity once you step out of the subway, living together. Brooklyn, also a little bit more stratified and segregated, and Staten Island predominantly white, working class with some new immigrant communities like Sri Lankan, New South Asian communities. So that's kind of a general overview from my lived experience. This is not based on any stats, but how I navigate the city. And a lot of the hotspots we were seeing initially during the beginning were mainly in areas where there was, already lack of access to care due to structural racism, classism, etc. And basically these groups were being blamed too for not maintaining social distancing, etc. And these were the communities that were actually supporting the pandemic and didn't have the option to stay home and work from home. They were frontline workers, they were still managing the shops, making sure people were getting supplies, working in hospitals, nurses, teachers, to people that couldn't really afford to stay home and kind of came through and was supporting everybody. So that's kind of what was going on. And then eventually too, there was a lot of stuff around, depending on where you were, people just not wanting to wear masks because of political or religious beliefs. So that was a big thing, and still is a big thing in the United States, where wearing masks was became politicized, instead of something that is required to maintain or contain COVID. So that's kind of where I'm coming from. I just wanted to open it up to you all for a little bit to see if you could draw any parallels from this situation to what you experienced. And you can chat, and Uma can give me some ideas if anyone's willing to contribute during this time.
So you're welcome to post in the chat box. If you would like to speak, please raise your hand. Please click the raise hand button. Thank you. I see somebody says, yes, we did. So had similar experiences.
And anything that was that's bringing things up for you as I am saying or talking about this, that's unique or similar.
Shelley has something to share.
Sure.
Thank you. Yeah, this brings up a lot of feelings of, I would say like a little bit of discomfort, because now I'm reminded of, the situation, how it was. But as a student, for me, it changed very rapidly. We were doing in-person classes, and then suddenly, we had to shift online, and, it was just so frantic and hectic on an academic level for me. And then, just the stuff about like going back home, but then not being able to travel. And also the fear, the financial dependency, and, that also came into play. So I think for me, the biggest one was not being able to go back to see my family, and also the academic shift that happened so fast. So as a student, and then a lot of my professors who were like, of the older ages, they had a lot of difficulties with technology and stuff. So it was just a lot of confusion and a lot of things going on at the same time. I mean, it was hard to understand what was going on, because there was just so much going on constantly, and then the numbers were just getting worse day by day. So, like you said, compounding, it was just adding and piling on, and we just didn't know who to trust, what to do, how to go about it, because there was no blueprint. Of course, this was so unexpected. Sorry, I'm rambling now, but this was pretty much experience.
Yeah, thank you so much for sharing, Shaili. Yes, and so a lot of what I'm going to be sharing too. So before I move on, I want to say too, it will bring up some stuff, if it does bring up some stuff, because we are going to be talking about certain compounding stressors. Please make sure as we're going into this taking care of ourselves, please make sure you take a time to breathe. If you need to step aside or walk away, get a sip of water. I won't mind it at all, before you want to join, take care of yourself. And I'm going to try to do some more grounding too throughout the presentation as I'm sharing some of this, but just wanted to kind of start with that, the context we're working with. Yes. Oh, okay. So
there
Go
was
ahead.
just messages in the chat box. So
okay. I guess we can address probably a couple if you.
Yeah, I think they were mostly comments anyway. They weren't questions.
Oh,
so I'll
okay.
just share that. So there was initially, we were not sure what is happening, and that this was from DN College. And Dr. Gurpreet Kaur shared, yes, situation was quite similar in Delhi, but in the second wave, things changed drastically, taking a bad turn. So, and then DN College also said, blessed were those who had a roof over their head and food in their plates.
Mm-hmm. Right, exactly. So a lot of the financial uncertainties, major businesses here, just were gone. And it seemed like, yes, when we're in crisis, we want to go somewhere where we're held and taken care of, and that was also taken away from us. So thank you so much for everyone for sharing. So I'm going to go ahead. With that being said, if we're going to do I'm going to kind of fast forward and do a somatic exercise with you guys. So a lot of the stuff that I do bring in that was helpful during this time because of this sense of feeling loss of control and all this loss at the same time, to kind of hold on to where we are, where we're grounded, and where we're being held. And that's going to be my theme throughout the presentation. So I'm just going to skip a couple of slides and just do the somatic exercise with you guys. So if you are in a comfortable position somewhere, and kind of roll your shoulders back. And I get a lot of my inspiration for somatic stuff from Resma Manikin. He's a phenomenal somatic therapist here in the US, and he wrote a book called My Grandmother's Hand. So that has been a really good resource for me during this time. So one of the activities he does is to kind of know where you are in the current moment because of our sense of dislocation, all this jarring stuff that you all shared, that came up and continues to come up during this time. So if you can find a place where you're seated comfortably and your back and your lower back is supported, your root is supported. If you can roll your shoulders back and just kind of focus on your breath and see how your body just moves naturally with your breath. And use your eyes to scan your room slowly and try to connect with your body to your surrounding. And if you have thoughts or minds, notice them, but come back to your eyes, making contact with every corner of the room. And notice any exits, windows. You can try to go behind you, around you, and remember to focus on breath as you're slowly taking it in with your body and your eyes, feeling all the different contact points where your feet are rested and also held, where the back is also resting and also being held. And just kind of breathe and relax into those different contact points, where the palm of your hands or also resting and being held. Just kind of focus on breath and take your time and do it one more time. And slowly come back and take a couple more cleansing breaths through your nose into your belly. Let go of anything you want to release. And yeah, so coming back, with the general sentiment of COVID and everything that was going on around us, this was a quote I captured when I was looking up stuff here too that was impacting students, and this was in the MIT Technology Review, where one of the Instagram influencers during the time, Seema Hari, who was trying to get oxygen tanks and so forth, was kind of captured this really well. It says there's so much collective and personal grief to process, but it is almost like we have not even been afforded the privilege to grieve, because loss is so relentless and so many things demand our action and attention. And you know, this is a part that really sits hard, where it's true, where, you know, when things are coming at us at all directions, where do we make space for this? And is it a privilege? And during crisis, our critical problem solving is also compromised. And that's why, you know, how we can actually widen our perspective by voicing the different valid sentiments, bringing awareness, and then make space for different people's emotional journeys is the key, you know, when everything is coming at you, and how we're also oriented to, you know, relate to emotional processing in general. So it to be really mindful that this was a common sentiment, and that we are going to talk about in a 3-part series, how to make more space and also really make space for different people with totally different beliefs in safety, how they came to us and we're grieving, where this sentiment will be helpful. So grief is a natural response to loss, particularly loss of someone or some living thing that has died, that you have a loving connection with, had a bond with. Although conventionally we focus on the emotional response to grief, it's a very complex process. It has physical, cognitive, behavioral, social, cultural, spiritual impact. So grief, if we can look at grief as a natural process and a form of love, everyone has their own way of grieving, and it is hard to grieve in isolation, which has made this situation a very compounding aspect, where we were forced to grieve and experience different losses on our own. Grief is, again, a complex emotional process. And as clinicians and therapists, what we have to remember is our own countertransferences, or how we're unable to kind of sit with grief our own, because it brings us face to face with our greatest fear of mortality and death, you know. So it's really, you know, really being mindful of the societal messaging about enough already, why aren't we getting past this already, you know, we don't have time for this. This is a privilege, like all that stuff that was coming up, or that quote also touched upon, to really be mindful of that and see where your messaging is coming from and how important it is to really join people in whatever place they are in this process. And that is one of the important messages or lessons learned that I learned even throughout this time of crisis. So these are kind of 3 treatment approaches I used in general with grief and grieving, and also tweaked it, integrated it more during COVID, because grief is a form of love. Attachment theory makes sense, how you frame it. So if you think of what a strong person in your life, that you're strongly attached, how they help you regulate emotionally, your sense of self, and also physiological processes such as soothing, eating, sleeping, making sure you're not stressed. So when that person is gone, obviously you're going to feel an impact in all those spaces or realms. So really framing it from the attachment theory model makes sense. And I also bring in family systems too, which really looks at, let me hold on just one second. Okay, which really looks at, I just kind of lost my place, I'm so sorry, which really looks at the shared experience of the reality of death and the shared experience of the loss. It's really important to remember, no matter what a person's situations, especially when it comes to children, to not really protect again from experience, or protecting people from the experience of the pain of the loss. It is such a vital part of the process. Again, looking at where the avoidance comes for you, where the protection is coming, and really looking at during this time how people are doing certain things, making certain decisions, or keeping very strict family rituals as they were to avoid the pain of loss. And then the second part that that also is a very common theme in when looking at this is also seeing how the family system gets disrupted. I don't know if some of you attended Dr. Mukamala's presentation on grief, and how she said it beautifully. It's like, who's not going to make the tea, So kind of looking at the different family roles and how the family system shifts those roles together. During this time, again, some families might hold on to the strict, family roles because, again, facing the pain is so painful. And some may make totally different, like ungrounded, I guess, decisions where, there's a huge disruption. And at the end, it's sort of like knowing that it will work out, you will be held, and things can become something new, a new system will arise. And then there's the dual process model, where the focus is looking at loss-oriented stressors and reactions, such as the grief work, the intense emotional process, denial, avoidance, and then also looking at the restorative-oriented stressors and reactions, such as having new purpose or pursuits, repairing any disruption, focusing on well-being. And a lot of this happens in parallel, it's not necessarily one happens and the other. You're doing two at the same time. And most of these approaches, that's what they're looking at. It's sort of like looking at how you are experiencing and touching upon the grieving process and the pain, and also the shift and the change that comes with it, that's restoring it, and your psyche is kind of balancing the two. The purpose of many of these approaches are looking at stressors of the loss and loss-related consequences, accepting the loss and the strong emotions that come with it, and then thinking about future and present with the loss and building a new purpose, new support network, and then eventually accepting the loss, whether it's looking at the reminders of the deceased and telling their stories in a way that brings more meaning. So the first part, and again, this is sort of me pulling from all, like my different casework, and then as I'm pulling from those three approaches, just looking at the cadence of what I saw. And again, everyone has a unique process of grieving, so it's not taking away from that unique process, but kind of the cadence that I noticed, and I learned from some training from other places, such as the Complicated Grief Center for Columbia University. So acute grief usually is in that initial part where the stressors and loss-related consequences and the intense emotions are coming, where you're sitting with it, joining with the client, making sure that the client know they can persevere the pain, and that they will be okay. There's a support system there. And the integrated grief is actually looking at
but if the team is coming telling,
oh, sorry. And the integrated grief piece is where you learn to now integrate the grief and see how you can live with it and can touch upon it as needed, and also allow yourself to feel it as needed throughout your life and see what meaning it brings to you. And what makes it, I guess, more distressful and prolonged, I know we've been using the word complicated grief a lot. That has been, that term has been changed to prolonged grief disorder, mainly because grief is complex and complicated for everybody in their own way. So now it's a new term that people are using, is prolonged grief disorder. And basically, the grieving part becomes prolonged when this natural cadence or process is disrupted by different stressors, which cause people to avoid the pain longer or not sit with it, or external factors where you don't have time. There's it's just too many things at once where you have to kind of push aside and move forward, or things are out of control. There's no sense of control anymore because everything around you, the infrastructure, everything around you is collapsing. So of course, COVID, there hasn't been any studies yet that show that people who experience loss. I mean, there have been probably, but the experience loss and bereavement leads to more prolonged grief disorder. But previous studies of other natural disasters and so forth have shown that it can be a factor because of those components of sudden and unexpected death, not having control over losing their loved ones, or even being there when they are dying. So that's why it's mindful as clinicians to see what these stressors are that are taking away from the natural grieving process. So this is the prolonged grief diagnosis for the ICD. Oh, did I stop it? Or did someone else stop the recording?
No, it's not you.
Oh, okay. So basically, this is the criteria for prolonged grief diagnosis, and you have to be in five, have to show 5 different symptoms, or have to show 5 different meet five different criteria for it, and that doesn't meet the criteria for anxiety, PTSD, or depression. And many of you can look it up, but basically it's increased irritability, numbness, still where people after 6 to 12 months are in this kind of raw, acute state of grieving. But with saying this, it is also important for everyone to understand, this is how I just approach mental health in general, that not to use this diagnosis as to pathologize the person's grieving process, but to really look at it to provide space and support and hold and honor that person's process, because different compounding factors got in the way, or that other spaces, the person doesn't have other spaces in their life that are providing that. So kind of looking at this, yes, as an as an indicator.
Sorry about it. I don't know what's happening.
Oh, no worries. It's good. It's good for editing, I guess. Yeah, to really be able to look at it as a holding space and how the person can get more support. It's interesting for prolonged grief disorder, a lot of studies showed how there's so much stigma for people to actually reach out for support around grief at this time, because people around them, or societal messages are telling them, oh, you should be over it already, because different people, again, grieve differently, and different things impact different people differently. And so it's such a stigma, like, oh, I should be over this, why am I not? But for most part, when people do find the right clinician support or group to really target the grief, and there's different methods for working with prolonged grief disorder too. Usually most people are so satisfied that they reached out and could process this in a more structured way. So the next slide, I'm just going to talk about how to distinguish between prolonged grief disorder, PTSD, depression. Again, all three can coexist, especially during times of trauma. But I guess to remember as clinicians, like what the difference between the depression and prolonged grief disorder is. Mainly, prolonged grief disorder can eventually lead to depression. And PTSD and prolonged grief disorder can coexist too, especially when things are so out of control and fear-based when the death happened. But the distinguishing factor is prolonged grief disorder. Its a main emotion is sadness related to the loss. And that's the central focus. And the avoidance is also related to the loss. Whereas PTSD, the avoidance is more fear-based and event-based. And also for depression, the sadness is more, comes from a sense of just void of self-worthlessness, sense of self. So those are some distinguishing factors to look at as well. So what we started talking about initially, as you could see, there was so many different factors that impacted all of us during this time, and continue to impact us with in different parts of the world, as some folks, things are hitting really badly now in southern part of the United States, whereas I'm in New York City now, and I'm still able to do most of my life activities because the numbers aren't as high. And things are just ebbing and flowing and popping up, and in different parts of the world in different ways. So we're still in it. The backdrop is still there. Like, we're still in it. There's this continuous kind of fear that we don't know when we're going to be hit next. This lack of control. And with it too, there's so many issues that came up initially, even when I talked about it, where it's almost decision fatigue, like, oh my gosh, where should I go? How should I plan? And looking at things, this is where my public health background has been helpful in my mental health conceptualization, is looking things from an ecological perspective really can help you kind of organize the different stressors and points of intervention and the areas of agency that you might have. So at the individual level, the lack of emotional and practical preparation for the death, circumstances around terminal illness, isolation, dying in isolation, the ambiguity of it, traumatic burden of the bereaved, and more at the, community institutions being then compromised due to just religious spaces not being there, family dynamics, which goes into the interpersonal piece, being shifted due to having kids now not being able to go to school, and the conflicts that arise from that. And then just the lack of, sometimes, yes, there was a lack of public policy and leadership, and also public policy and leadership that did come through to wrap around and support small businesses, or making sure things weren't as dire. And then the multiple deaths continuously being focused on through media, and where death was reduced to a statistic, a number. So, these are just some situations where you can go through and just look at the different layers of focusing on different stressors at each layer, and see where you have agency as a clinician, and where others can also have agency, and where there's an opportunity to organize, to impact public policy, to what happened here in New York, which was beautiful, was there was a lot of, like, in the face of crisis, neighborhood pods popped up, where they had information and resources very specific to the neighborhood, and it was very informal, and but it did the job when there was, like, no information, yeah. So and then I wanted to just kind of turn it back to you all again to see how this model would be helpful for what you're experiencing right now or in the past.
So you have some comments in the chat and some questions, Urmi. I don't know when would be a good time for that.
Sure, let me just check.
I mean, I can read them out to you.
Okay, if you can. Yeah, I have so many windows open. Sorry.
So can you see it, Uma, or shall I do it for you?
I can see it. I just can't organize. I can't copy and paste I can't copy the questions, so I can't organize them, but that's okay. I can, if you can copy them then and send it to me, that would be great.
The copying is not happening at my end also, so
yeah, I think it's disabled.
I'll jot it down. Yeah, so
yeah, it's okay. I can go over them. So Urmi, I wanted to know if you wanted people to react to this particular slide, or if you would like me to go over some of the questions that have been asked.
I can go over some of the questions, and then we can also, I'll probably do some questions, and then we can also see if there's any reactions to the slide or what I just shared.
So I will go back then. Okay, apologies. So there were some comments. So DN College said disenfranchised grief was unrecognized loss, and COVID-19 people were unable to grieve even the recognized loss, no space. Every soul was overburdened. How much of death and sadness can a person process? So the question that Garima asked is, could you please explain the role of attachment as a treatment process?
Sure. Mainly attachment as a treatment process. If we look at grief as a natural, it brings us back not to pathologize the process or avoid the process, as a natural form of love. So, looking at attachment as a process is kind of looking at what the attachment figure did for us when they were there. You know, it's regulate us at an emotional level, psychological level, giving us a sense of self. And then I forgot the third one, and then regulating us physiologically, whether it's like sleep, eating, all the stuff that's been dysregulated. So kind of framing it that way, it's sort of like, how can you provide soothing in that sense, whether it's a physiological loss, or physiological dysregulation, emotional regulation, how to be held, and, you know, just looking at how, you know, the attachment figure even soothed, you know, people when they were in stress, looking at how people in acute grief probably aren't exploring and going more inward, because when you have a secure attachment, that's when you know you can go and explore more, you're more outward, you're not as inward. So kind of looking at it from that perspective helps you kind of frame when that, you know, attachment figure isn't there, all the stuff that gets dysregulated. So kind of using it that way. I hope that answered that question.
Well, I think she has a follow-up to that, so I'll let her speak.
Oh, okay, sure.
Good evening, ma'am. I'm Garima. I'm pursuing my master's in clinical counseling and positive psychology, and I'm from India. So, ma'am, it is related to my Masi. She lost her soulmate or Masatri in this COVID times. And like you talked about attachment right now. So my question is that if, you know, you attach, like it was a companion and no one can give that same feeling like physically or emotionally to her in this time. So how will the attachment theory like help us, like the treatment process help her, especially when, you know, the relationship that they shared cannot be shared with someone else?
Yes, and that's like a common sentiment that comes up with a lot of my clients, and I would say not to get caught up on finding a replacement of that, but trying to focus on the different people and parts in her life that can soothe her in different ways and can hold her emotions, you know? So, because I think a lot of us, even the person grieving, get caught up with, how can I ever fill that void? No one can ever replace that. And that's very true. But the purpose is to see where you can now reorient and look at different spaces that can provide some holding and soothing, and allow yourself to do that. And whether it's a therapist, whether it's other family members, it's probably going to be in different spaces, but being able to do that. I hope, was that clear? Or
yes, ma'am. Ma'am, one more thing, sorry.
Sure.
Ma'am, so for grieving, is it important that the person should accept the loss?
That again, there, you know, again, I know eventually, you know, it's like there's a, you know, if the person accepts the loss, meaning that it's integrated, they're still honoring the grief. So grief, once the loss happens, this is how I look at it. It's always going to be there. It's just how you relate to it and how you let it come into your life. And you just have more control over how the emotions ebb and flow because of it, you know? So that process, it's unique to different people, what acceptance even means. But also, I think the importance is acknowledging that it's always going to be there, and that's okay. It's how you manage how it comes and impacts your life.
Okay, ma'am. Thank you so much.
Of course. Thank you for your questions.
Okay, so So you have a lot of questions. Okay.
Oh gosh.
And
I'm not an expert in any means. I'm here to learn from you all too. So this is just, I wanted to open it up to you guys to see.
Trying to organize this for a moment, Urmi. So,
Sure.
so this is like a multi-part question. I think this is related to developmental stages. And so Freud, when talking about the melancholic person, speaks of how the person's ego latches the loss object to itself and doesn't really grieve. Is such identification pathological, or does it help in coping, especially in the case of adolescents? Similar question was asked about how to help grieving folks in their children, how to do that with children. So Indrila Basu asked, how do we confront a kid over loss? Like we want them to know and face at the same time the concept of death may be complex for a kid. So how do we acknowledge death to them? And then there's one about an older person, but I'll get to that after you respond to children and adolescents and what your thoughts are.
Sure. I'm not an expert working with children. Working with, I would say there was an instance where working with even someone who, who was older and didn't even had brain injury, didn't know what was going on, was institutionalized. And even in that situation, it was important that the person could experience their own grief and pain. So I'm not, again, I don't work with children with grief and loss, but from what I've heard and trained in, it seems like it's important, no matter what stage in life you are, where you are, to really be able to experience that grieving process and grief and allow that person to experience it for themselves. And obviously with children, probably, someone who is more an expert in that field can provide the appropriate scaffolding while the child is processing the loss.
Thank you, Urmi. Any thoughts on adolescents? I think that was part of the question. And of course, then, what I'm hearing you say is that everyone has their own process, and particularly with children being vulnerable, it is probably best not to push it with them, right? Not to confront them too quickly, perhaps not to have our own expectations imposed on them. It takes time and they need structure, right, to process the grief. So consistency, care, all of that. So any thoughts on adolescents? And I think this is also related, Shaurya, one of the questions that was asked was, how do you help an older person with loss? And related to that, there's a question about an older person with loss who seems to be stuck in the anger stage and gets into blaming someone, say a country or a race, for the personal loss.
Yes, no, so going to the adolescent piece, I think Uma answered that really well. And it also, grieving shows up in a lot of different forms during adolescence too, especially young boys, as in a form of anger and so forth. So it is, again, important to provide, not, as being parents, not impose your expectations of their process and really have a space where they can be processing it with the right supports in place. With older people with that particular situation, it does sound like it's a more prolonged grief situation where, yeah, and looking, that's been a huge part of this pandemic, is blaming other groups. We're in this crisis situation where, again, that critical thinking piece, making space for differences, totally goes out the window because we just don't have the mental space for compassion. And it's like a bigger collective grieving process, where going back to the attachment theory piece, where the sense of self is compromised, where self-compassion, compassion for others especially people who are different from us and disconnected from us before pandemic, it's just exacerbated. And but so it's always important to kind of look at the core emotion that's there, that's not being expressed or being held properly. And that's also where complicated or prolonged grief treatments, if the person's open to, again, to therapy, might be helpful to really see if it's something that's prolonged and really getting in the way of their day-to-day lives or life. Yeah.
So Urmi, what I will say is, if you can finish your presentation, and then we'll take the rest of the questions, because they're, I think, related, but may lead us in different directions. So there's a request for showing the previous slide, if you don't mind.
Sure.
If you go back to your previous slide.
Yes.
And then
so looking at the difference between depression, PTSD, and PGD. Yeah.
And just as a reminder, the session is being recorded, so you will have access to it even after it's done.
Yes. Yes. Okay. And is there a particular question with regards to this slide?
I think once you're done with your presentation, we can then.
Okay. Okay. Yes. So basically, we can come back. It was just the sentiment of sadness being the distinguishing factor, sadness related to the person, the loss, to be the distinguishing factor for prolonged grief disorder. So, and these are just mainly like the emotions that, as a clinician, going through the different stressors that we talked about, the reactions, the emotional reactions you might see. So more at an individual level, and then more at a systemic level. Looking at guilt, shame, regrets for not doing enough, anger towards the system, with the undignified body disposal. Over here, we had like freezer trucks, and it was just seeing that image brought back so much trauma. And the same thing is happening again now in southern and middle parts of America. Anger towards deceased for not maintaining safety measures, threat of the uncertainty of the death, anticipatory grief, just the lack of control, and then the sense of loneliness and death being reduced to a number. So the anger even coming to that, just not being, the person not being recognized. And then just with the more of the systemic stuff, the systems being disrupted, like a general rise in anxiety and worries, feelings of lack of safety and insecurity, experiencing prejudice, increased like victimization and discrimination, fear of one's own morality. That has been huge, and that's coming up a lot, like the discrimination piece and blaming others, and blaming themselves for not being safe enough, blaming the person who's deceased not being safe enough. And it is like it is a huge stressor for like really grieving with compassion towards for yourself and the person who is deceased. Let's see if there was anything else. Okay. So some of the lessons learned for me during this time was really looking at how emotions, because of everything going on, how the embodied experience of emotions were occurring as well. Of course, because no matter what, so I experienced very few direct deaths from COVID, other than family members and probably one client due to COVID. Most of my grieving or clients who were grieving people who died of other terminal illnesses that couldn't get care because the systems were so saturated due to COVID. So and which increased, what I saw was a lot of increase in just body anxiety, no matter what the terminal illness was, because they experienced death and all of a sudden, they're just sort of self-isolating too. So like, we don't want to, like they just face mortality. It's like, just don't want to do anything with COVID. I don't even want to catch it. I don't even want to take that chance. So just that added layer of just shutting themselves off from family and friends even more. And really, I'm learning too, even though we're taught, oh, you don't grieve best, on your own, you need a group to grieve and so forth. But I realized joining the patient or the client where they are emotionally sometimes is so much more important during this time than them being forced to attend rituals, even funeral rituals, and really going into the client's internal world of what is going on emotionally for them, how hard that is for them. So I, again, it's really looking how to scaffold the client where they are and not judging, because everybody else is judging how they grieve, for how you should do this, how you should do that. So creating that safe space where they can authentically talk about where they are, and also their own process of, I should be over this already. There's so much going on in the world, like I should accept the loss by now. I should be here, because a lot of people too, they're like reading up on grief a lot and they're like, this is painful. Like, I still feel a lot of guilt and shame. Why am I not over this? So really slowing down, helping people to slow down and just help them sit with where they are. What was really helpful too with the family systems piece was to kind of bring in close family and friends as soon as I was noticing there was going to be loss, to start talking to family and friends, what's soothing, what they're doing, if my client allowed it. This was particularly helpful for one of my clients who had passed away. I had to reach out to her husband and make sure what is soothing her, what is helping her, what would be her last days, her last wishes, to kind of make sure that she passes comfortably, and what I can do to the best of with the limited resources for that situation. For this particular client, she was in a place where she was hearing other people gasping for air, and as she was dying, so we kind of arranged so that she could be in a place where she could die more peacefully. And in the midst of all this that is going on, just finding little space of comfort and joy on a day-to-day basis, that should be the focus. And being able to accompany people. And we talked about this, my colleagues Nancy and Summer, we were tied, like even when our hands are tied, and as sad as sometimes some of these situations are with where we feel like we don't have agency, the fact that we're accompanying our clients and there and holding them makes such a difference, let's see, what else did so that's some, and then just remembering again what I mentioned in the slide before with the ecological model. We as humans are extremely creative and resilient in times of crisis, where different groups were formed to fill the gaps of the system. Computers and laptops were donated to, even here, there's a lot of access issues around, where schools went online, where children were not getting lunches because the school system provides lunches and most of computer access to, poorer communities. Where the neighborhoods came in and make sure that kids were connected to the internet, had internet access, had school lunches, unions received subsidies to make sure that members still continue to have health insurance. So there was a lot of policy leaders like screwing us over too, for lack of a better term. And there were a lot of things that were just happening ad hoc, that where people were coming together and trying to build newer systems that are sticking now and staying in place. And then just seeing how people did try to find those different spots of agency where teachers were organizing to make sure educators are better taken care of, and for, you know, like just looking at really holding the different things that people are doing when so many things seem to go wrong, and we, you know, there's so many things that aren't going right around us, was really helpful. So so that's all I have for lessons learned. I mean, there were much more, but I want to open it up to you guys to see if there's anything that you learned from your experience that I can learn from, and the rest of the group can talk about more.
Thank you, Urmi. I think you can stop sharing your slides. Oh, okay.
Oh, okay.
Yeah, and that way we can all see you.
Okay.
Or, I mean, did you want to write them out on the slides? Is that what you were thinking?
Oh, no, I'm fine. Whatever. I just kept a slide for that.
Okay. Awesome. So there are lots of comments, lots of, you know, there's some questions. So let me start with some of the questions, and then so one of the questions is, what if someone is numb after a loss? How do these people process grief?
Again, I usually open up my sessions where I just make sure it's meeting the person where they're at. And sometimes if my client is sort of like, you know what, I don't even want to see you today, you know, I just need to be on my own. I'm like, okay, because I had a couple of the, you know, sessions where they just experienced the grief and they're like, I don't even know what I'm doing sitting in front of you. I'm like, okay, let's take a breather, drink some water, reach out to me when you're ready, you know? So, and that's what they needed, you know?
And then there's a question about, excuse me, unable to mourn or grieve in a ritualistic way during the COVID times, did take away the support that a culture or socially sanctioned, I guess, the rituals or procedures that provide. How do we cope with this loss collectively? So I think this is such a great question, because so much of this trauma is a collective trauma, right? It's shared between us. So how do we process this collectively or cope with it?
Yeah, and I'll probably, you know, direct this back at you all too. But how we've been kind of looking at it here is sort of, you know, making sure people are connecting to different groups, seeing that the global connection, even me being here today, I feel like kind of honors that collective trauma. Like India's grief is our grief here too, you know, like because there's so many people impacted by it. New York's grief, everyone was looking at it, you know, like looking at New York City when it was recording, you know, or talking about death and loss. Italy, you know, like it felt for the first time, you know, where we could label your grief is my grief too. And that is such a powerful statement to kind of honor the collective grieving process and rituals. And just with the resilience piece that I talked about, there were new rituals that were created as well that, you know, created that holding space. And us to even being able to voice the loss of rituals that we had to let go of, you know, which was also very painful. Because when it comes to death rituals, I think that's one thing, or rituals around grieving and death. It's one of the factors in all cultures where, you know, it is very prescriptive, and you might be, I guess, liberal or not that religious in other aspects, but when it comes to stuff like this, it is very, you just do things, you know. So just having that change of not having that structure in itself was a grieving and loss or a grief and loss process. So I think acknowledging that and seeing what's coming out of it, that is, helping you support or helping the collective support in the new times of what we have, and focusing on what we have was very important.
Yeah, thank you for that. Yeah, it's such a, I think there's somebody who also commented that this is such a heavy topic that it's really appreciated that you asked us to take a break and get a sip of water if we need to, and so on. So I think you answered this question. I'll just label it because, I guess it's on people's mind. Can you discuss a little bit about overall, excuse me, grief management, like how to start and proceed with a patient? But I think you went over that after this question was asked. I don't know if you had anything to add or anything that.
Yeah, I think, a lot of stuff that was being circulated during initially when I was dealing with a lot of loss was the 5 stages of grief model, and was our go-to, which is fine because it labels some of the major emotions people go through, but it also takes away from not using again using these different treatment approaches as much. You pick and choose so that you can scaffold the person in front of you going through this journey, holding them, soothing them, and the initial part of it is the different kind of like the numbing, the guilt, all these like intense emotions coming up, which you try to hold, label, and usually there's not much space sometimes other than the therapist's room to really talk about it honestly, even before COVID, because people always, there is this messaging like, oh, you're grieving, you grieve with the family, just, you should move on already, but not really labeling that piece because you're so also, you're also dealing with the aftermath of the loss, paperwork, funeral arrangements, just moving forward where the pain is never really held and you don't sit with it. And for clinicians too, we avoid it a lot. It's really hard for us to just sit with it because it brings up so much stuff for us, which I mentioned initially. So it's really looking at your own countertransferences of not, if you're not making that space to really join where the client is, and also label the client's wish of the person being lost or the person who has passed away, and seeing not to take the onus of the blame and guilt of the loss of the wish of the person being there. So that's one of the other strategies that I use in acute grief.
Thank you. So some folks have shared in response to what are the lessons learned. So just sharing some of that. So isolation during COVID made the grieving process so tough that even after accepting the loss and trying to cope with it at times, it did come back for a few people time and again, and they still feel heavy about it. And I would say that, I mean, that is to be expected, and it probably will continue. We're going to process this grief for years and decades to come. And sitting in India a few years back, when I used to read about different virus outbreaks in the African continent, I never imagined that a developed nation would fall so flat in the face of such adversity. It's true. We've had, the United States was brought down to its knees, because of this pandemic, and it exposed so many cracks in the system when we make such presumptions about the access that we have. Garima said, gratitude was something that made so much sense in COVID times. Yeah, your grief is my grief too, one world. Yeah, that was really appreciated. Another lesson, I guess, appreciating little moments in life was also a learning. Just being able to talk to your family was a blessing, and so comforting as it gave us the sense that they are okay and with us. And we're all in this together. Grieving digitally has been something which was existing since the 80s, but COVID-19 flooded the gates of grief and mourning and social media. And I think that's a great point too, that maybe now we are transitioning some rituals and collective processes to a more kind of global sense, right? Then Garima said that this too shall pass. Affirmation was one of the major driving forces to cope with stress and uncertainty. Shaurya said, I would like to acknowledge how the government is providing financial support to students who lost their parent in such hard times. And we as a friend, neighbor, have to play our role too. So one world, right? Your grief is my grief in this sharing for certain. Okay, so this is a personal question for you, Urmi. Can you please discuss how you got into grief and bereavement work? What caught your interest?
Believe it or not, it was COVID-19. I had no choice. All my clients in New York at least had one death due to COVID or COVID-related situations where the hospital system was saturated, and many young adults losing parents, and facing grief for the first time. Yeah, so I mean, initially, before I actually joined or transitioned into mental health, I was in IT before. I actually was a grief counselor for kids, like as a volunteer, and that was many years ago. And I did that because I was working with cancer patients, young cancer patients, and I started doing some stuff at the hospital, but that was just for a little bit. And then mainly through COVID is what I had to kind of learn a lot this past year, and my supervisor was great.
Thank you. Yeah, I think we're all learning so much about grief. Thank you, Urmi, for sharing. We have about 7 minutes left, so I will just kind of, there's one more question. I think this is a pretty broad one. So, and I think we will get to some of these things in the next 2 sessions. So just as a reminder, we have Dr. Nancy Sweeney's session on Tuesday, is that August 31st, at the same time, so at 7:30 p.m. your time, and then Ms. Summer Collins, who will also be talking about coping strategies and self-care and all of that on September 4th. I'm sorry, I'm getting my days confused today. It's Saturday, September 4th at, again, 7:30. So, so Manisha Verma asked, what to do when a person keeps asking why it happened with them, why this incident or loss, when so many got cured, or why she lost her husband when she was there all along with her, eating from the same plate. So sharing, I guess, why her husband, and so this is part of the guilt, right? Survivor's guilt. What kind of mindset it depicts, or what stage of grief is it? What coping strategies can be suggested?
Right. Again, I stay away from stages. So it's labeling the emotional reaction to that. So it's guilt, like Uma mentioned. And so again, really joining with the guilt, and eventually just seeing how there's so many things you can control, so many things you cannot, and there's so many variables, and really coming to terms with what this person could do for her husband and what was there and what has been built eventually when she's ready. So again, a lot of my clients want to get to that state. They're like, I'm still feeling the shame. And I'm just like, let's join where, let's see what that's saying. It's painful, but you can get through the pain, So we avoid it because it is painful. Of course, we don't want to be in pain, but so you can create that holding environment so that you can sit with them and allow yourself to sit with them, with the emotion.
Thank you, Urmi. Again, you're getting lots of thank yous and wonderful
thank you.
presentation.
Thank you all for coming and joining. Yes, and thank you so much for this opportunity. Yes, and I look forward to knowing and learning more from you all and being a part of this network. Really appreciate getting to hear some of your voices, and thank you for your comments and questions.
Yeah, I just want to give a shout out to MAP for organizing this in collaboration with Indear, and thank you very much for creating this space, and to all of you for attending. Just as a note on grief around, when we experience loss that is so traumatic, it is really hard. And on top of that, all of us have to, in these times, really are under so much pressure to just keep going, right? So I want to thank MAP for creating this, what I would describe as a pause. So for this moment for us to be able to just pause and reflect and to be able to take in some of this knowledge, experience, lived experience, all of that when we are going through such difficult times. So thank you all for attending, for being part of this session, and for the wonderful questions and comments. Please join us on Tuesday. And I think our moderator will be Ms. Diksha Bali from Indear. And on Saturday, I think it will be someone from MAP. So I really appreciate being able to moderate this session, and I very much look forward to having you join us for future sessions. Thank you, and keep the comments and questions coming.
Thank you, Uma. Thank you so much for bringing such a wonderful topic to India, and such wonderful speakers, so learned and well-qualified speakers for all of us. It was great, having you all, and thank you, Uma, for arranging all this and for this collaboration. Thank you so much.
Well, you're welcome, and thank you. It's one word, like we've come together during these very difficult times, and sometimes we have to see the good things that have come out of these experiences. So
yes, and as a closing, to make sure you all breathe in love and light, and take this in. I know we shared a lot of hard stuff, so I want to make sure you feel grounded in whatever you have to do after this. So take care of yourselves.
all right, goodbye, everyone. Thank you.
Bye. Thank you.